A lot of people are sort of one medical event away from complete and utter financial ruin. It's pretty insane that medications can cost, upwards of $80,000 plus.
Hi, friends. I'm Dr. Emma Diaz. Welcome back to Wealthier Mindset, the place where we talk about all things money and mindset. I'm so excited to have you here. If you're interested in changing your relationship with money, if you want to have more gratitude, mindfulness, excitement around money instead of stress, check out my website at wealthiermindset.com. I have a ton of free resources in there if you want to develop a gratitude mindset, do some money mindfulness activities where you can get some insight into why you think about money the way you do, even some things on how to create healthy money habits. Check it out if you're interested. Today, I'm going to be talking with my sister, Ciera Diaz. She's a licensed social worker. She's been working in the medical social work field for over 15 years, and she's worked with all kinds of people in all kinds of institutions, everything from hospital settings to dialysis clinics. Right now, she specializes in working with transplant patients and helping them navigate the transplant process. So we're going to be talking a lot about the intersection between healthcare and money, which is such an interesting conversation, especially in a place like the US. Please listen in. I'm so excited to have you here. Thanks for coming in.
Thanks for having me.
So for folks who don't know, this is my sister, and I would argue the world's best social worker. How many years have you been
About
doing,
that.
how many years have you been doing this?
I started in the field in January of 2008, so about 16 years, is that right? Obviously, I'm not a
Wow.
math person. I'm in the social sciences. So,
That's a long time. That's a weird time to be entering the field too, 2008.
well, it was when the recession had
Hmm.
hit. So,
Yeah. Did that change your career trajectory coming in during that time?
no, but when I started in the career and when I was in school doing my practicum, I worked with the homeless population in my second year of graduate school.
Mhm.
And a lot of the homeless population were people who had come from all around the country to Las Vegas, thinking that somehow Las Vegas's streets were paved with gold and ended up getting stranded and ending up homeless. So that was a huge part of our population around that time was, people who were affected by the recession in other states who then moved to Las Vegas thinking that things would be better, only to find out that things were much, much worse.
Oh God, that's horrible.
Yeah. Yep, and Las Vegas was one of the places that was hardest hit by the recession, and so, like I said, we had quite a few people who ended up stranded and homeless in Las Vegas because they were leaving other states hoping that things were going to be better.
That's so hard because you see things, right? And you think, oh, well, there have to be more opportunities here, or there have to be more opportunities in this place. And it's not always the case.
No. So,
Like divorce, loss of a job, and I want to say like medical. Like if you have a
mhm,
really
that wouldn't
significant
surprise me.
medical,
Hmm.
yeah.
Yeah, I mean, from what I've noticed, a lot of people from working in the medical field, a lot of people are sort of one medical event away from complete and utter financial
Mhm.
ruin. And I know that I myself am in that category,
Mhm.
and I thought about that over the years that I've worked in healthcare is that, this could be me if I
Mhm.
had was in a major car accident or had some other major medical event, I would be in the same
Mhm.
person's shoes. So
That's so scary. So I was reading this book called Die with Zero, where he talks about this idea that we
that
basically
sounds
like
uplifting. Die with zero. Okay.
right? It's a catchy book title. And he talks about this idea that our goal should be to die with zero, in that like any money that we leave behind is money that we basically didn't get like maximum enjoyment out of. And so he
Mm,
talks about like, if you're saving for retirement, so many folks save for retirement, but then they only have a few good years of retirement before they can't do much. And
Mhm.
then they're not using their money. And he talks about like if you have kids, give them money while it matters. Like instead of dying and leaving them with money when they're in their like 50s and they're finally stable, like give it to them when they're in their 20s and they're like getting out of college or getting their first job. But he talks about this idea that so many of us are afraid of running out of money. And he said in the book, like, you will never get enough money to prevent a major medical issue. Like, if that happens to you, you will probably not have enough money to cover that. So stop worrying about it. And
Hmm.
that was just like a major turning point for me because I had always thought, like, oh, you can just save enough. But it's like if you have a significant medical event, like you could
Yeah,
owe millions and millions and millions, and you just can't save for that
that's
unless
true.
you're the 1%.
Yeah, that's true. And I've seen medical bills that are in excess of millions. So yeah, I think people would be surprised to see, what things actually cost, which we all know is,
Mhm.
healthcare costs are super inflated.
Mhm.
But yeah, I mean, you're right. No matter how much money the average person makes, if
Mhm.
they have a serious medical event and their hospital bill is, hundreds of thousands of dollars, I mean, there's not
Mhm.
going to be much you can do about that anyways.
Yeah, not unless you're Taylor Swift, but everyone, unless you're like a billionaire,
Yeah.
the rest of us just have to hope and pray that we don't have that or that we have the right insurance. But then if you get the right insurance and you get a medical event and then you get let go from your job, like it doesn't matter.
Well, even I don't think there is such a thing as right insurance. I mean,
Hmm.
there's plenty of articles out there about how, insurances refuse to allow patients to get certain necessary testing that's vital to diagnosis and treatment. And so, unfortunately, I think there is no such thing as the perfect insurance. And that's part of the problem with
Hmm.
incurring medical debt is just that you could have what you think is fantastic insurance and they might
Hmm.
fight with you over paying claims or, even paying for necessary tests.
Yeah, yeah. Well, I'm thinking about like my insurance. I have a really expensive medication, like 15 grand without insurance, which is nuts, right? Like no medication costs 15 grand to make. It's
No.
absurd. But but it's new. So there's no generic version. And it's so arbitrary, like whose insurances accept and deny sometimes. Like it's so arbitrary. We can have the same diagnosis, the same medical need, like the same everything. But for some people, their insurances approve it right away and you get lucky.
Hmm.
Some never approve it, or some approve it, but they make your life miserable every step of the way getting there.
Yeah, or they'll require what's called a prior authorization, which basically needs to show that your provider has tried various other different medications first before they will approve that medication. So it's almost like you're the guinea pig where you have to be on whatever different medications
Mhm.
for your insurance's requirement before they will pay for the one that is actually going to work, which I would
Mhm.
say it seems like in a lot of cases when a prior authorization is required, people have already tried other things, but that may not
Mhm.
always be the case. And even with your medication costing 15,000, that is kind of on the low end of what I've seen some medications cost. I mean, especially
Wow.
oncology medications when I
Mhm.
worked in the pediatric hospital and I saw some of the medications for our pediatric oncology
Mhm.
patients, it's pretty insane that medications can cost depressing conversation.
Insurance. I'm remembering that episode of Superstore where Jonah tries to like create a new
Oh, yes.
insurance plan. He's like, there's got to be something better. And he's like, makes this whole plan and it just falls apart.
And everyone chips in money, right?
Yeah. Yeah.
And it's this like community pool, and then they start listing everybody's healthcare needs and trying to figure
Hmm.
out how this pool is going to cover everybody's various different healthcare needs.
Yeah.
Yeah.
Which some communities I think do. Like, I think some people can find a way to pull it off. But it's not easy. I don't think.
Yeah, I don't think
There's a
it
lot
will
of
ever be.
problems with
I
it.
don't know. I'm not as familiar with healthcare systems in other countries. I just know that some countries have much better healthcare systems than we do.
Mm-hmm.
Actually, one of the nurses I work with recently, I don't know how we got on the topic, but the topic came up of, you know, healthcare being better in countries that have universal health
Mm-hmm.
healthcare. And so I just kind of looked up some things and was trying to find some articles because I was just curious. I was like, I wonder if people who live in countries with universal health care, if there's
Mm-hmm.
any like health benefits to that. And I actually
Mm-hmm.
did find an article that said that people who live in countries with universal health care have a life expectancy that's 10 years longer than people who live in the US. So that was just one
Wow.
article. I just found that interesting. But I've also heard complaints of people who um, live in countries with universal health care where they have, a lot of difficulty getting in to see providers, and it may take a long time to see providers, to get a diagnosis, to get treatment. So it's hard to know without having worked in those healthcare systems. It's hard to know which is better.
Mm-hmm. I think the thing that comes to mind too, well, it's two things. One thing is that even just the fear of healthcare costing a lot, I could see taking years off of people's lives because I can think of times in my life where I didn't have as good a healthcare. And it was always a decision whether or not to go to the doctor, right? It was like, should I go to the doctor for this? What kind of tests are they going to run? How much is this going to like put me in the hole? Like, how much is this going to cost? Can I budget for it? Versus when you have healthcare that covers a lot, it's like, oh, I'm in pain. I should go to the doctor and get this taken care of. And
I mean, or you may have better coverage, but still have out-of-pocket costs, that
Mhm,
you consider. I mean, even in February, I got sick. It wasn't COVID. I don't know what it
mhm,
was, but some pretty horrible cootie that I caught. And um, between trying all kinds of different medications and
mhm,
nothing would alleviate symptoms. I mean, I think in various just over-the-counter medications alone, I probably spent upwards of $100. And then
mhm,
when I reached out to my primary care provider and asked about, recommendations, they wanted
mhm,
me to go in for an appointment to make sure that there was no issues in my chest, any pulmonary issues. And then I'm like, well, that's another $25 that I have to pay for a
mhm,
copay. So it's like altogether, just for, whatever it was, a cold
mhm,
costs probably close to $200, which I mean, it was tough for me to afford, let alone I can
mhm,
only imagine somebody who has a much lower income. So, I mean, those are huge considerations and why oftentimes people don't get preventative health care, or they're in
mhm,
pain and they don't go to the doctor. They're feeling sick. They don't go to the doctor because there is that consideration of how
mhm.
much is that going to cost.
Yeah. I mean, we've had clients at different places that I've worked before die because they didn't go to the doctor when they should have because they were concerned about how much it was going to cost, or even how much it was going to cost to get to the doctor, right? Like
Yeah.
if you're not very mobile and you have to order an ambulance, that's way different than even like you were talking about resources before, right? Do you have family in the area you can call to take you? Can someone bring you in versus having to order an ambulance? Order an ambulance, not like a pizza.
Yeah, I
But
thought that was an interesting way to word that. I'm like, I don't know how you open an ambulance.
I don't know.
Not
I don't know. I
sure.
think there's like a 3-digit number you call and it just
Yeah, something like
comes right
that.
up. You just order it that way. Yeah. Um, and well, the other thing it made me think of too is that I've been thinking a lot about this lately. This idea that
Mhm.
what we like and want as humans is not always what's good for us. And
Well,
so I
yeah.
think about like with universal healthcare, I'm sure people have a lot of issues with like maybe having a provider they don't love or like wanting certain things. And at the end of the day, are you or are you not going to get better healthcare with universal healthcare, right? Is it possible that something we don't like doesn't mean it's not actually better for our health? I mean, even looking at maternal mortality rates are
Oh, yeah. It's,
pretty atrocious in this
yeah.
country and
Yeah.
continuing to go down.
For a country as wealthy as America, it's
Hmm.
it's shameful. Of course, that relates to other things as well, but that would be that would go down a whole nother rabbit hole. But
And it's just going to get worse. It's just going to continue
yeah.
getting worse. Yeah.
Yeah, but I mean, that is unfortunately a huge consideration is, and before President Obama passed the Affordable Care Act, which
Mhm.
I, as a social worker, have noticed such an incredible change. I mean, that was just so unbelievably helpful for so many
Mhm.
Americans. The fact that if they otherwise had no access to health insurance coverage, that they could now access coverage because
Mhm.
before the passage of the Affordable Care Act, I mean, again, like you said, people die. I saw people who died because they could not afford things like insulin, which is still
Mhm.
expensive, even with insurance. Um, but yeah, I mean, people before the ACA, they were
Mhm.
not able to get coverage, period. And now, thankfully, that is an option for many more people than it used to be.
Mhm.
And that also, the Affordable Care Act um, allowed for Medicaid expansion. So, like in Tennessee, unfortunately, they did not elect to participate in the expansion.
That's
So,
shocking. Isn't that shocking to hear?
No, but yeah, I mean, in Tennessee, for example, there's certain eligibility criteria that people have to meet in order to qualify for Medicaid, which Medicaid is like a joint, um, how would I word this? It's like a joint program, federal and
Mhm.
state program. It's a federal government program that's administered and run differently by each individual state.
Mhm.
So in Tennessee, because it's managed differently in each state, there's different eligibility criteria. In Tennessee, because we didn't elect to expand Medicaid, there's only certain eligibility criteria that people have to meet. So, for instance, being pregnant or having
Mhm.
children, being on supplemental security insurance or SSI, having a disability. But in other states who elected to expand their Medicaid, people can actually qualify for Medicaid based on income alone, which is really
Oh,
nice.
wow.
Yeah, so in other states that have other eligibility
Mhm.
criteria and where they have expanded access to Medicaid, that income criteria alone can help them qualify, which is really nice because,
Mhm.
even with the Affordable Care Act, there's some people who really struggle to afford the cost of the insurance plans through the
Mhm.
health insurance marketplace. And so yeah,
Mhm.
even though they may be able to enroll in a plan, the monthly premiums, deductibles,
Mhm.
pays may still be too expensive for people. So yeah, it's great that now we have access to health insurance for more people, but again, it comes down to affordability too, where not everyone can afford um, a plan, or they get a plan and they're scraping by to cover the premium, but they can't afford things like deductibles. I have a patient that
Mhm.
I actually, she calls me probably every 6 months with the same
Mhm.
problems because she has a plan through the Affordable Care Act or the
Mhm.
health insurance marketplace, also known as Obamacare,
Mhm.
colloquially.
Shout out
And
Obama.
yeah, the good old days. But anyway, so she has this plan that she pays like $700 a month for, okay, that she doesn't use and won't use because her deductible is like
Oh
$9,000.
my
So not
God.
only is she paying a monthly premium of $700, but she's essentially paying that for nothing because you can't use it because she'd have to meet the $9,000 deductible before their insurance will start to cover anything. So that's a good example of how, it's great that, and that's, I feel like sort of an outlier. I feel like most
Mhm.
patients I talk to, they're able to afford their premiums and copays okay. And, there is through the health insurance marketplace, people can qualify for a government subsidy if they have low enough income and resources to where the
Mhm.
government subsidizes part of the insurance plan costs. But anyways, I feel like that's an outlier.
Mhm.
In terms of the patients I've worked with who have coverage through the health insurance marketplace, but that's just a good example of somebody who's
Mhm.
paying for an insurance plan but can't even use it because she can't afford to.
Mhm. Well, and that's like just such a great example too of why so much of economics and finance needs to be systemic too. Like we can do individual things, but there also need to be larger changes because that should not be the case, right? That someone has a $9,000 deductible. Like most people, the average person cannot afford that.
No.
It's just not going to happen. And I think about being so in grad school, I was in a rural conservative place in a liberal state, Illinois. And now I'm in a more like urban or progressive part of a very conservative state. So it's sort of like flip-flopped. And I don't think I realized how much state laws impact you in
Yes.
addition to like local laws. Because in Illinois, I actually used Medicaid. I believe it was Medicaid. I don't think they called it Medicaid when I was in grad
Yeah,
school.
every state will technically, I mean, it's Medicaid across the board, but states
Hmm.
will call it different things. So, for instance,
Hmm.
in Tennessee, it's called 10 Care. I don't
Uh-huh.
know why I remember this, but in Arizona, it's called Access. For some
Huh.
reason, I remember. I can't even remember Nevada's Medicaid, but I remember Arizona. So, anyways, yeah.
Hmm. Yeah. Yeah, but I used that in grad school because I turned over 26 and no longer had dad's health insurance, but I was making like $12,000 a year and there was just no way I could afford healthcare and I had some access to healthcare through the university, but it was like an obscene cost. Like I was like I can't afford to pay,
Mhm.
you know, if you're making like $1,000 a month, you can't afford $200 a month in addition to just like living and buying groceries and paying for things. And so, like, but I also don't think I realized how easy that process was. Like, that process in Illinois was super
Hmm.
easy. I just like went online, filled out my insurance, like, filled out my income and stuff. I
Hmm.
don't know that it would be that easy in Tennessee. I don't know
Yeah,
what
that
it's like.
probably varies by state. And it sounds
Hmm.
like if you qualified for it at that time, it sounds like, obviously Illinois must have taken advantage of that Medicaid
Hmm.
expansion. So, because you were obviously likely eligible just
Hmm.
based on the fact that you had low enough income.
Yeah, I think that's the only reason I was like I
Mhm.
didn't have any special
Yes.
category or anything like that that would
So
have
that's the
qualified me
beauty of
for
the
it.
Medicaid
Hmm.
expansion is that you
Hmm.
were eligible, because if you were in that situation in Tennessee, you would be out of luck. You would not be
Hmm.
eligible for Medicaid in Tennessee, and you would have to get a plan through the health insurance marketplace. Although, again, like I said, given that you had low income and resources at that time, you might qualify for a government subsidy for help with some of the cost of the marketplace insurance plan. So.
Hmm.
But still, I mean, that just so goes to show you, you happen to be in a state that
Hmm.
took advantage of the Medicaid expansion. And if you were going to grad school in Tennessee, you would not have been able to qualify for Medicaid.
Yeah.
So it makes you think again about where you're living. These are
Hmm.
considerations. I think, unfortunately, it's interesting though, but I think it's a consideration, where you live is going to also impact the healthcare resources that you may or may not have access to. So,
Hmm.
and some people have
Yeah.
an option to pick up and move somewhere else with maybe
Hmm.
better healthcare access, and lots of people do not have um, that luxury, so to speak, of just being
Hmm.
able to pick up and go somewhere else where they can have access to better healthcare
Yeah. Well, even
or
in
better
terms
healthcare
of,
services.
yeah, even healthcare systems, like I'm fortunate now that I have healthcare through my job, so affording it isn't an issue. But I'm right by Vanderbilt and they give exceptional healthcare. I can meet with a specialist who's like, it's like a specialist within a specialist. Like he does like something super niche. They don't have that a lot of places. Like I'm just thinking about like our family in Nevada. Like we've had some family in Nevada and family and friends who've needed like specialized healthcare. And a lot of them have ended up having to leave
Yeah, you have to.
where they
In
were.
a place like Nevada, yeah, you're not going to get, first of all, you're probably not going to get as specialized health care because it's just not there. And you're just not going to get as good of care either. It's just one of
Mhm.
those places with a horrible healthcare system. But
Yeah.
even here with Vanderbilt, it's a huge healthcare system in the Southeast, and there's people from all over and outlying regions and states that drive to Vanderbilt for the care,
Mm-hmm.
not just only better care, but also specialty care. And
Mm-hmm.
so, there's patients that come from Alabama and Georgia
Mm-hmm.
and Kentucky and,
Mm-hmm.
just all of the outlying states, they will travel in to access that healthcare. And when you're talking about healthcare expenses and you're pretty far away from where you receive your healthcare, then those are additional expenses. So cost of gas, having to stay in a hotel, before or after your appointment, what have you. So those are all additional costs because again, these are people who are not living in places where they have access to good healthcare. And so
Mm-hmm.
that's back to our point of, getting access to healthcare and getting access to good healthcare partly depends on where you live.
Mm-hmm.
And if you can't afford to pick up and move, then you may have to travel back and forth to a place that's a
Mm-hmm.
couple hours away from you, and then you have additional healthcare costs.
Yeah. Well, and
So
if you pick up and move, you might lose your job that gives you access to
yeah,
the healthcare,
exactly. Or other
which,
benefits
mm-hmm.
or your support system, your family may be there and
Mm-hmm.
there, which I have seen happen before. I have seen where people live or people move to like Nashville, say, to be closer to Vanderbilt for their care, but then they have to leave their social support system behind, and then that puts another added burden on them. So,
Mm-hmm. Yeah.
so yeah,
Well,
it's
I'm,
tricky.
oh, go ahead.
I just said it's tricky. That's all.
Yeah.
It's very tricky trying to manage your health, especially, I mean, and I think within this context, we've only kind of mentioned, maybe going to your primary care or you have your specialty appointment. But when we think of people who have even chronic health conditions, things
Mm-hmm.
like diabetes or chronic kidney disease or hypertension or what have you, and they're having to make very regular trips, I mean, that just adds to it. So if you're somebody dealing with a chronic illness, chronic pain, uh,
Mm-hmm.
even things like substance abuse, and maybe there's no treatment
Mm-hmm.
by where you live. So I mean, all these things um, are just going to, you know, impact your finances
Yeah.
to travel more frequently. And then I feel like, unfortunately, from what I've noticed, you rarely see people with one chronic condition or another. A lot of
Mm-hmm.
chronic conditions, from what I've noticed, this is just anecdotal, I'm not a doctor, but a lot of them seem to go hand in hand. Like we know two of the leading causes of kidney failure are hypertension and diabetes. And
Mm-hmm.
so people who have diabetes and or hypertension may also have chronic kidney disease. So they're managing multiple chronic conditions at the same time.
Mm-hmm.
That's increasing the frequency of travel and appointments and copays and medications. And so, yeah,
Mm-hmm.
it just
Yeah.
compounds and compounds. So, the people
Mm-hmm.
who, and that's why I think prevention is so important. And I wish that our healthcare system, this is part of why it's so broken, I
Mm-hmm.
think, is because we don't put any emphasis on prevention. And so I
Mm-hmm.
think if we could really catch some of these things and educate people and have like healthcare literacy classes in
Mm-hmm.
schools and things like the financial
Mm-hmm.
literacy, healthcare literacy and financial literacy are tied together
Mm-hmm.
because
Yeah.
everybody's going to need healthcare at some point in their life. Just
Yes. Yeah.
everyone's going to have to make money and earn money and manage
Mm-hmm.
finances. So um, I wish that we had that focus on prevention because, then we may not have people who are struggling so much just to get by because they
Mm-hmm.
have something like diabetes, but it's impacting every facet of their life.
Mm-hmm. Well, and there is something to be said too, right? Like, I think it's so hard because I wish there was more incentives for engaging in health behaviors because we are such a hyper individualistic country, right? Like we love to focus on the individual. And I think it is true that you as an individual have to do certain things, right? Like that is true. No one can force you into it.
Yeah.
But then I also think about like we also don't have a lot of infrastructure that helps with that either. So then it just sort of compounds the issue of like, I think about how neat it would be if we had incentives like, getting an hour off of work if you want to exercise, If you don't want to exercise, you don't get it. But if you want to go to a yoga class or go for a run or whatever it is, like you get that time back.
Hmm.
Or things like if insurance would pay for things like gym classes or memberships, and they could even pay by like how much you go instead of just like a flat fee of like we're paying for this, right? It could be like any class you attend will do this, or we'll give you like X amount off your deductible if you go to the gym X times per
Well, some
month
of
or
those
X
things
times
actually do
per.
exist.
Mhm.
Like I know some Medicare plans, they have like the silver sneakers where
Oh,
they'll,
that's cool.
yeah, so different like exercise programs or gym memberships. And
Mhm.
even I know where I work and with my health insurance, every year they have something called Go for the Gold, where
Mhm.
you have to complete certain little health challenges, various different health challenges. Some are as
Mhm.
easy as just like um, coming up with 3 goals for how you can
Mhm.
better your health in the next year or something. So if you complete enough of these health challenges, then you get like, I can't remember how much, I want to say $280
Mhm.
that goes towards various costs.
Mhm.
So yeah, there are things like that here and there, but it's
Mhm.
definitely not widespread enough. I think
Mhm.
it definitely needs to be, all
Mhm.
insurances need to have things like that, all jobs. Because I do feel like some jobs try, like you
Mhm.
said, take an hour here, but I feel like it's not a matter of it's like that's an additional hour, right? So
Mhm.
yeah, you might be able to take an hour to go exercise, and they may encourage that, but then that's going to add an hour to your workday. So it
Mhm.
would be nice if that were something that were encouraged and you can only have a 7 hour workday and then an hour
Mhm.
of it is spent exercising.
Yeah. Yeah.
Um,
And
because
watch
I
the
mean,
sick leave go down.
yeah, I know. And when you think about productivity, I would probably help with productivity to get that hour
Mhm.
of exercise in, mental health. I mean, it's all tied together. And like what else could somebody get done in that extra hour? Like I just feel
Mhm.
like if you've already put in 7 hours of work, chances are like you've been productive for the
Mhm.
day and you can have an hour to go exercise.
Yeah. Yeah.
But yeah.
Absolutely. Well, I think about like when I
Doesn't
work from
happen.
home. No. When I work from home, like my breaks look different. I want to
Mhm.
say they look like laundry, but I don't do laundry as much
Wow.
as sometimes they look like laundry or cleaning. Sometimes they look like, sitting and reading a book in the
Mm.
corner for a little bit of time. But like that same thing happened in the office. It was just me talking to other people instead, right? Like we all have dead space in our jobs because that's also just how humans function is we
Well, and you
can't
can function
be
for eight
doing that
hours
much.
straight without taking a
Mm-mm.
break. I mean, I have
No.
before, but I don't know that I would say I functioned well. I mean, when I
Or
worked,
we're healthy.
yeah, relatively, I
Mhm.
guess. But I mean, yeah, I mean, there's lots of people who don't take breaks for whatever reason, whether they feel like they can't find time or can't make time or whatever, there really
Mhm.
is no time, maybe they've got patients, back to back, but
Yeah.
yeah. That's
Well,
a
and
whole
have
other issue
we,
getting into. I really do feel like the nature of our employment system in the US also severely impacts our health and well-being. So I just feel like
Mhm.
we are pretty much worked to death
Mhm.
and we're expected to work until we keel over and, like
Mhm.
Social Security age, for retirement keeps getting pushed back. And it's like, good Lord, by the time I'm ready to retire, they'll probably say, oh, you can't collect your Social Security retirement until you're 80. Who knows? But
Yeah.
it's literally
Yeah.
like this country lives to work,
Mhm.
It's like that's what we do.
Yeah, we
So
love that. We love working ourselves to death, like working ourselves to the bone. And you hear other countries that have like months off or fewer work days or things like that.
or
And
shorter work weeks. I remember when
mhm.
I had applied for a job in Wales, I think it was, they had like a 32-hour work week. I think it was
Mhm.
4 days and 32 hours. Which sounds reasonable because the way I feel,
Mhm.
it's like with 2 days off, I always feel like right when that second day off comes around, that's when I
Mhm.
finally kind of like settling down and starting
Mhm.
to feel like refreshed, only to have to go right back to work the next day. So I really feel
Mhm.
like that third day would be super beneficial.
Well, and if you have anything to do, like earlier this morning, I was changing my phone company because I was like, I'm paying way too much for my phone. Like, this is just nuts. And I don't need to do that. So I was changing my phone company. And it took me all morning to do it, um, which it shouldn't have. There was just like an issue with the SIM card
Part of
I
your
got.
time off. That's time that you're supposed to
Right.
be recuperating from your work
Mhm.
week.
Yeah. So it's like if you have anything, even if it's fun things, right? Like
Yeah.
tomorrow I'm going to the symphony and I'm so excited, but I'm also like, okay, I only have 2 days off. So how do I like plan
Get everything
around?
else done because you still have to
Yeah.
get your adulting. You've got to get your
Hmm.
cleaning and your laundry and your grocery
Hmm.
shopping and, other things done. If you have kids, which,
Hmm.
you know, I don't, but if you have kids, then you've got to get them to practices and games and other activities. So yeah, I just think when you think about the fact that most work weeks are, 5 days, 8 hours a day, it's like, you know, how do
Hmm.
you fit the rest of life into, because it's not just the time you're at work, think about the fact people have to spend time commuting to and from work, or even some people like me, unfortunately, who take their work home and they're thinking about work when they're at home,
No.
or irritated at their horrible boss when they're at home. And that's
Hmm.
consuming part of their, time
Hmm.
away from work. So yeah, that's why, like I said, it's like we just, this country, we just all work ourselves to
Hmm.
death. And I'm
Yeah.
sure, I'm sure
Hmm.
a lot of these habits contribute to poor health, things like
Hmm.
heart disease and,
Hmm.
diabetes, because when we're stressed from working, overworking so much and not getting any breaks at work and having an employer who doesn't encourage healthy work habits, then we are not eating as good as we should. We're not
Hmm.
sleeping. And so those things are absolutely interconnected.
Hmm.
Our work culture here in the US, I think, is absolutely connected to our health problems, not just physical, but mental health and
Yeah.
everything. So,
Well, and like I've heard some folks talk about this in relation to finances too, right? That like when you're working that much, you're also making less money. So like you might have a job where you make $200,000 a year. But if you're working 80 hours a week, are you really making that much more per hour than maybe
no,
someone
yeah,
that
that
makes
makes
a
sense.
100,000, but they're working like a regular work week, right?
Less. Yeah.
And just even thinking about like commuting time, there's so much time that we give up for work that is not compensated time.
Mhm.
Where like I take the bus because I hate driving and felt like I was taking my life in my hands. I'm not the best driver, which I know people don't often admit, but I'm not the most amazing. I'm a little too safe, I think. Um,
Yeah, I think 55 on the freeway is a little too safe, but
some
anyway.
freeways have speed limits that are 55 though,
Okay.
so counterpoint. Um, but I take the bus, but that means also I leave 2 hours before I start. Like I leave my house 2 hours before I start. I get home an hour and a half after I get off. So it's like that's 3.5 to 4 hours on the days I'm in the office.
Yep.
That's just unaccounted
Depressing.
for.
It's depressing. Yep.
Yeah. Like that's a bummer.
Yep. Yeah, I think anytime you have to make a commute that's more than 20 minutes, it makes things that much more difficult, you know.
Yeah.
Because
A
think about
thousand
too,
percent.
even like from a mental health perspective, it's like what if you have a horrible day and then
Mm-hmm.
you start your commute home and there's an accident and it takes you 2 hours to get home. Obviously, I'm sure lots of people would say, oh, we'll put a fun podcast on, or, like, that's your time to think about what you're grateful for. But I mean,
Mm-hmm.
we all know that that's the ideal. But, when
Mm-hmm.
you're stuck in traffic that's not moving for, an hour or so, it's
Mm-hmm.
that it just puts that much more strain on you. And again, then that ties into you get home and you just want to. Maybe you don't have time even. By the time you get home, it's taken so long, you don't have time to make a healthy meal. And so you
Mm-hmm.
just, grab some fast food or something that's super unhealthy. And so
Mm-hmm.
then maybe you're so uptight from everything that happened that day in the commute that you don't get good enough sleep. And so,
Mm-hmm.
so yeah, I absolutely um hate our work culture here in the US. And it hasn't been until the past couple of years either that I haven't been guilty of being one of those people that just like has no work-life balance and
Mm-hmm.
works a ton of overtime and
Mm-hmm.
just didn't even really think about it. I'm like, well, the job needs to get done. I've got to
Mm-hmm.
stay to do it, even though your bosses don't care, like nobody cares. They're
Mm-hmm.
not saying thank you so much for spending 3 extra hours of your life here at
Mm-hmm.
work. They don't care.
No,
Um,
you, if you stop being productive, they would fire you in a minute,
yeah.
right? Like they would not think twice
Hmm.
about
Yeah.
firing you.
Yep. But it seems like, the younger generations have a different outlook on work, which is
Mm-hmm.
good. Because I guess I'm considered what, an elder millennial, early
Or
40s.
there's a lot of people I think who are like the cusp of Gen X and millennials that really don't consider themselves millennials. So like if you don't want to be taken in by us,
Wow.
we don't have to have you. Although we would
I don't really
accept you with open
care.
arms should you want
Yeah,
to join.
I don't have to fit into one category or another, but
That's no, that's untrue.
whole nother story. But yeah, I think that the generation that I'm in, whatever that is, early 40s, I think that we're still of that mindset where, you work and you work and you
Mhm.
work and you work and you get the job done and you go in when you're sick, whether sick means
Mhm.
having an actual cold or your mental health is not good that day or you didn't
Mhm.
sleep the night before and you feel like absolute hell and you go in anyways because that's just
Mhm.
always how things have been. That's sort of the mindset, the mentality. So, but younger generations, it seems like, don't have that same mentality, which is probably going to be better for their overall health. So,
Yeah, I think it's definitely a different mentality, almost in even in terms of like what you owe an employer, right? Like how much of your time and even
yeah,
just life energy you owe them. And that's what he talks about in Die with Zero too. He talks about this
life
idea.
energy.
Well, no, no, he
That
talks
sounds
about this
like some
idea.
new age. Yeah.
Yeah, but he talks about this idea that our time represents our life energy and like how much of our time or life energy are we giving away in exchange for money that then we're hoarding?
Hmm.
And so, how do we find this balance of like not giving away all of our time to just hoard something that we're not making use of? But I was going to say something related to work culture, but I think I forgot.
It had to do with life energy,
Yeah, it had to do with life energy.
how they suck the life's energy out of you, your job.
Oh, I remember what I was going to say. No, I think it is more so related to this idea that, like, I think about this a lot with work is when you don't have that much free time. Like, I'm sure you've had the experience, right? Where you just have like time off that stacks in a row, like during the holidays or other times where you just get more free time than you
Mhm.
would normally get in a year. Like, normally you get maybe a few days here and there, but you sometimes get it where it comes at once. And when that happens, I notice myself like creating more hobbies because I have more time that I can continue doing it. So I will like, start playing the piano again, which I think what I could be doing, the word play is loose. It's a loose interpretation of what's happening. But I can do it because I'm like, oh, I'll have time again to do it in 2 days or next week. And so when we have more time off, I feel like we can actually create more hobbies versus when you get sporadic time off, you don't get to do that because you're like, why would you pick up a guitar if you're not going to be able to pick it up again for 3 months, right? Like we don't develop, I think we don't develop things that will make us healthier because if we know we're not going to get to do them again soon, like
Well,
what's
yeah,
the
that makes
point?
sense. Yeah, that makes
Mhm.
sense.
Whereas if we all had, a 4-day work week or 35-hour work week, I think we would do more because we could make it a regular part of our routine.
Well, yeah, and we'd have more time to do more because,
Mhm.
like I said, it's like your first couple days off may be spent running around like crazy and
Mhm.
doing laundry and groceries and other errands that you can't otherwise do during the week. And so even that extra day, I feel like could be a day that's strictly dedicated to like doing something fun or picking up a new
Mhm.
hobby. And if you had that extra day every week, then yeah, you could stay engaged in that hobby and it would become part of your routine. And we know
Mhm.
that more something becomes part of your routine and it becomes a habit, the
Mhm.
more likely you are to continue to participate in that. So and maintain
Mhm.
that long term.
Yeah.
So yeah, unfortunately, I think we're we're not going to change the
We're
employment
doomed.
culture here. Yeah, we just would have to move to another country. So,
I have considered that. Well, and it's interesting because I think there are countries, like we often think of the US as being the best,
well,
but
Americans often think of the US as being the best.
that's true. That's true.
Americans who
We
are not as
Americans often
cynical.
think that.
Yeah, I don't
Um,
think, I'm more cynical. So yeah, maybe Americans who are less cynical tend to think America's the best.
well, we think like we have a lot of freedoms compared to other people, like which is true. And
Hmm.
yet, there are other countries that do have higher taxation rates where people are happier,
Hmm.
or countries that make less but have more social safety nets where
Hmm.
people are happier. Because I think we have this idea here that, like, the more that you can make, sort of having no ceiling on it, is what's going to make people happy because then you can make a lot of money and you have all this freedom to do it. But then I think we're sometimes seeing real life evidence too that what makes people happy is like not feeling like they're going to get a medical diagnosis that's going to put them on the street, or feeling like if they lose their job, they're still going to have access to like food and healthcare. And that those things are actually create more happiness than being able to be a billionaire, which
Hmm.
most people just aren't going to do.
Yeah, and we know time and time again from different, research that comes out that happiness is not linked directly to money and to income.
Mhm.
So we know that.
Mhm.
I actually just saw this TikTok video. Was it yesterday, I think? And this woman, I don't know if she lives in France or what. I think she's an American who lives in France, but she was talking about the differences in losing a job in the US compared to in
Mhm.
France. And so
Oh,
basically,
wow.
US, it's just like, yeah, we're letting you go. We don't have to tell you why. Like,
Mhm. At
don't
will.
or hit you on the way out type thing.
Mhm.
And oh, by the way, to maintain health insurance coverage, you can enroll in Cobra, which is, only like $700 a month. Most people without a job can afford that. Of course, I'm being
Mhm.
sarcastic. But then in France, she was saying that they give you a full explanation of why they're letting you go, and they give you
Mhm.
time to, basically to prepare before your
Mhm.
employment ends. And obviously there's universal health care, so you don't have to worry about, health insurance coverage if you
Mhm.
lose your job. So yeah, I think it's interesting, Americans, for all the freedoms and wealth that we
Mhm.
may have in this country, there's also other things, other complications that we have to
Mhm.
deal with, in this type of culture of,
Mhm.
being married to our jobs and
Mhm.
what to do if we lose our job and with health insurance. And
Mhm.
so, yeah.
Well, I'm just thinking, even like having seen friends and things like that get really sick and need their health insurance. And this idea that a company can choose to take care of you,
Hmm.
right? And I think in a lot of situations they do because they don't think people are inherently bad. Like I think when they have the opportunity, they will try to accommodate you
Well, yeah,
if
and
they
they're
are
supposed to not discriminate.
right.
So,
Yeah. And
yeah.
yet at the end of the day, like it does look different to have that as a protection
Hmm.
of, even if I lose this job, I can still access medical care, as opposed to like, this is just my employer's goodwill that I'm here
And the
right
same
now.
medical care, like think about that too. So think about
Yeah.
you're in a country where there's universal health care, you've got your primary care doctor. If you lose your
Mhm.
job, you're going to be able to go see that same primary care doctor. Whereas in the States, you lose your job and whatever insurance you have, then if you pick up another insurance plan, you may not be able to resume your health care with your same provider. So that
Mhm.
again is something that's going to impact your health, is having to
Yeah.
reestablish care with somebody else. And
Mhm.
so, I mean, that when we talk about the continuation of care and how important that is, especially in
Mhm.
managing illness and chronic illnesses, I mean, something like loss of a job can throw a huge wrench into your
Mhm.
continuity of care and really create some serious health setbacks.
That's a really good point because I think about like if I lost my job, like I've looked into what insurance is, I could afford on my own and things like that. But it's hard to know, right? Like, would you still be eligible for the same medications? Maybe
Hmm.
you're still eligible for medications, but not the same medication. And we know that switching everything, your medical providers, your PCPs, your medications, things like that, that's horrible for your body. Even when you switch a dog's food, they're like, don't switch it all at once. Like, switch it a little bit at a time. If you're supposed to do that with dog food, like, imagine switching a major medication. That cannot be good for your body.
Yeah, or even providers. I mean, you may have a wonderful provider that you've been
Hmm.
seeing for 10 years, and then you get stuck with a crappy provider who,
Hmm.
it doesn't know you from Adam, and they're trying to pick up where the other provider left off.
Hmm.
And so,
Yeah.
yeah, absolutely, that lapse in health insurance. And even let's say that you lose your job and you're able to find another job quickly
Hmm.
and pick up really good insurance coverage. Well, that still doesn't mean that they're going to cover the medications you were on before and the
Hmm.
providers that you were seeing before. So, even if you get really fortunate in picking up another job, another insurance plan, your medical care may still suffer.
Yeah. Yeah. Even if it's a great provider, you have to start all over with them.
Yep.
What is something, this went by fast. What's
Yeah.
something that you wish people realized about maybe like the healthcare system and money or just their healthcare?
Well, I feel like that's a whole nother conversation with that question alone.
Okay,
I,
okay. What would you leave someone
well,
with?
well, what I would say is, and this is hard because when you mentioned earlier that, systems all impact each other, right? And so, like, for instance, like the educational system has an impact on the healthcare system, and all these different systems are interconnected. So, my initial thought was, I just wish people would really educate themselves, because I think that health literacy is so low in this country. Because again, we really don't talk about health until a health problem arises.
Hmm.
And so, but then that goes back to not everyone's going to be able to educate themselves properly because they may have a lower level of education just in general. They may
Hmm.
not have even finished high school or middle school. So, with that in mind, kind of that caveat aside, I still think that people can educate themselves through, friends or through social workers,
Hmm.
through the doctors that they're seeing. I mean, there's ways, I feel like there's ways, even if somebody has a lower level of education, I think there's still ways to get good education. Stay away from the internet because, people like to take to Dr. Google and WebMD, and then they find all kinds of conflicting things. And instead of having like conversations with their healthcare providers, it's more of an adversarial relationship. And well, Dr. Google said this, but you're telling me that. And I do think, again, it's hard. This is a very nuanced area, but I just feel like people need to increase their health literacy. They need to do what they can to educate themselves. Obviously, you're going to have to take to the internet because you're going to have to research things, but just make sure that you're looking at reputable sites,
Hmm.
that. So, for instance, you could ask your doctor, you could ask your social worker, you could ask your nurse, like, where are some places I can go to get more information about this diagnosis? So that way you're not just on the internet with God knows is going
Hmm.
to what kind of you know information is going to pop up, because I think
Hmm.
it's hard too when we're talking about educating ourselves. We don't want to be reading the wrong stuff that's going to
Hmm.
mislead us, or we don't want to get misinformation, which is super easy to do nowadays. So even like
Hmm.
I wouldn't take to a place like TikTok or YouTube
Hmm.
unless I knew that they were like reputable, like maybe they are board certified providers giving this information. So yeah, I think that people need to just educate themselves. I think that education equals empowerment. It allows you to better advocate for yourself. I think that if you're not educating yourself, it's kind of that saying, you don't know what you don't know. Because otherwise, if you don't, the alternative is that you're just going to end up being basically a victim of the healthcare system. You're just going to end up with chronic illnesses that are not well managed and poor quality of life. And, so you really have to make your impact on the healthcare system instead of the healthcare system just impacting you. I don't know how
Yeah,
else to put it.
I love that. That sounds like the perfect ending sentiment of,
Yeah,
like
we talked way too much into this. I gotta go
no,
eat.
about engaging and
Yeah.
being not being passive,
Hmm.
but being an active participant in your life. I would say even like that very much relates to mental health too, right? Like physical health and mental health, of like
Hmm.
being an active participant in your health and learning to take responsibility for it because no one is going to advocate for you like you are.
Nope.
Awesome. Well, thank you so, so much for coming on today. It was so great to have you.
Thanks. Appreciate your time. I'll talk to you
Yes.
later.
All right. Bye.
Bye.